Good morning. So now we are going to discuss about the pharmacodynamics or mechanism of drug action. Now before go to the this pharmacodynamics, now what is mean by the pharmacodynamics? So as we already studied that the pharmacodynamics it is refers to the mechanism of drug action. The mechanism of drug action. What does it mean? After administration of the drug, what is the role of the drug, how the drug is modifying the disease condition, or you can say that body's pathogenicity, and it will produce the action. Now if we are considering about the what are the different principles which involve into the drug action, there is a major five principles are there. These are the stimulation, depression, irritation, replacement, and cytotoxic action. Now, whenever we are talking about the stimulation, it refers to the selective enhancement. Let's selective enhancement of the level of activity of specialized cell. That means you can say that whenever we are talking about the adrenaline, what is there? They are stimulating the heart, or pilocarpine, cholinergic drug. It is increasing the salivary secretion. So all those things is the example of the stimulation. Coming to the depression, so in the depression what will happen, it is that after administration of the drug, it will cause the depression to the specific cell or the specific area. For example, whenever we are talking about the barbiturate, benzodiazepine type of the drug, what they are doing, they are suppressing, they are depressing the CNS. If we are talking about the H2 blocker like ranitidine, or we can say that proton pump inhibitor like omeprazole, what they are doing, they depress the gastric acid secretion, etc, etc. So this is the one type of the depression. Next one is the irritation. Now irritation means it is that you can say that it is a noxious effect. Here it is noxious effect when it is produced when it will apply to the less specialized cell, for example epithelial, connective tissue, etc. Now we can see that different drugs, it is after administration they can produce the inflammation, necrosis, you can say that morphological damage. So all those things you can say that is the irritation. Next is replacement. Replacement means already some endogenous substance are there in our body which is playing important role to maintaining of our health. For example, we can say that hematinics like iron, vitamin B12, folic acid, what for they are important? They are important for the generation of the RBC. Insulin, in case of the insulin, what they are important? They are regulating the blood sugar level. Now whenever there is a diabetes mellitus, we can say that one of the approach of in the diabetes mellitus is to give the insulin. Now this insulin we are used as a drug. Similarly, hematinics, iron and other things we are giving as a drugs in condition of the anemia. So these are the replacement. Next is the cytotoxic effect. Now in the cytotoxic effect, we know that a number of the drugs are there which is uh, act by producing the cytotoxic effect. For example, cancer cell. For example, you can say the tumor, you can drug used into the treatment of the tumor. What they are doing? They will go and they will you can say that kill the unwanted cell or cancer cell, tumor cell, or the parasite, virus, bacteria, etc. And they are killing that particular living cell which is not required for our health. So that is we are calling as a cytotoxic action. Next is what are the different targets of the drug action. A drug can be acted by the different way. Some of the cases, the drug it will act by their physical mechanism. Some of the cases it will act by their chemical mechanism. For example, here some of the examples are there. Like isabgol, it is act as a bulk laxative. Now this is the property of the physical mass. That means they are, you can say that, absorbing the water. and they are, you can say that, become the bulky in nature. So that is their physical property, no interaction with the any chemical interaction or attachment with the receptor. No, this is due to the physical mass. Like you can say that, dimethicone, petroleum jelly, they are, you can say that again based on the physical form. So these are the activated charcoal. Activated charcoal, if we are giving it the poison, they will absorb the, you can say that, poison, of course, in the specific area, or you can say that they having the antidiarrheal condition. Activated charcoal, when we are using the antidiarrheal condition, they will absorb the water, and they will, you can say that, act by their physical property. For example, antacid, and now in case of the antacid, they are neutralizing the gastric acid, because antacid are base in nature. So that is the chemical property. Like you can say the chelating agent. Chelating agent again act, they will form the complex with the uh, heavy metals, and they are by, and through this way they are, you can say that, inhibiting the heavy metal poisoning. Now, what are the major targets of the drugs? The major targets of the drug include the enzyme, transporter, ion channel, and receptor, which we are going to discuss in detail.